name is Hannah Antosh, and this is the Endocrine System for Dr. Sandra Barrera, Biology 515, Human Anatomy and Physiology. Today's presentation is covering oxytocin and vasopressin, specifically a study in which oxytocin and vasopressin were analyzed in conjunction with parental care and then compared to levels of empathy. To start off, empathy is a part of the human experience that increases our ability to communicate effectively and hold interpersonal relationships. Empathy allows us to understand a person's viewpoint, to understand how they might be feeling, and to take in another person's perspective. There are two main subdivisions of empathy. The first one is called cognitive empathy. And cognitive empathy is the ability to understand a person's point of view as well as understand their perspective. This could be on an issue, this could be a general worldview. The second subdivision of empathy is called affective empathy, and this is the warm, fuzzy feeling that we get when we look at babies or puppies, or the concern that we feel when we read terrible news articles or we see someone we love doing something dangerous. In short, empathy allows us to connect with other people. Now, and empathy can also be influenced by parental care. Parents who are very involved in their children's lives, are very warm, very affectionate, tend to have children with higher levels of empathy. Now, there are also a multitude of chemicals that go into empathy, but the two that we're going to look at today are oxytocin and arginine vasopressin, also known as AVP or just plain old vasopressin. Now, some research suggests that oxytocin plays a role in human empathy. Oxytocin is also involved in a myriad of social emotional processes. But results are still mixed. There aren't really any definitive studies. Not definitive studies. Rather, the studies that are out tend to be fairly conflicting on the role that oxytocin plays, although it's almost undeniable that it certainly does play a role. Vasopressin also has a role in human empathy. Vasopressin also works within our vascular function in things like vasoconstriction and water retention. But it does play a significant role in parental bonding, partner bonding, and our social interactions, I guess you could say. Variations of that AVP V1A receptor, so that arginine vasopressin receptor, V1A receptor should be precise, has been associated with autism disorders, but which tends to be defined by a lack of empathy and missing social cues, but it also has been associated with pro-socializing, so it can swing either way. Vasopressin has also not been proven to improve cognitive empathy, but it has been shown to improve affective empathy. Recent studies do still suggest that familial care impacts how individuals are susceptible to oxytocin and vasopressin, how those two chemicals, I guess you could say, can impact a person's empathy and social life. So the study that we're going to look at today administered both oxytocin and vasopressin to participants and then tested their empathy levels, and we'll get into that in a second. But the main hypothesis for the study is that oxytocin and vasopressin would increase empathetic concern in comparison to a placebo. But it would only create a difference in those who received higher levels of parental care. And I want to point out very specifically that this hypothesis says parental care. It doesn't make a distinction between maternal care or paternal care. And that also the hypothesis also does not make a distinction between men and women. It doesn't state that men will have high levels of empathy with warmer parental care. It just is a blanket statement. So the participants in this study were 125 undergraduate students from the University of California, Los Angeles. 90 of these participants were female and 35 of them were male. They were in a range from 18 to 31 years old. The average age was 20.88 years, with a standard deviation of 2.7 years. These participants were paid between $40 and $50 to participate in the study, and the participants were randomly assigned either intranasal oxytocin, intranasal vasopressin, or a placebo. 42 participants were given oxytocin. 30 of those were women, 12 of those were men. 42 participants were also given vasopressin. Again, 30 female, 12 male. And then 30 females were given the placebo drug, and 11 males were given the placebo drug as well. As far as racial distinctions, 56% of these participants were Asian, 20.8% were white, 13.6% were Hispanic or Latino, and 4.8% were Black, with the rest defining themselves as other. There were several exclusions for participants. Participants could not have active allergies or cold symptoms, heart disease, hypertension, myocardial infarctions, cardiac arrhythmias, migraines, asthma, nephritis, diabetes, endocrine diseases, fainting, stroke, aneurysms, brain hemorrhage. They were not allowed to have restricted fluids for any medical reasons. They were also not allowed to be on vasoconstriction medications. They were also excluded those with psychiatric illnesses, those who engage in alcohol abuse, those who are pregnant, breastfeeding, smoking more than 15 cigarettes a day. Participants were asked to refrain from taking medications or alcohol for 24 hours prior to the study. They were asked to refrain from caffeine for 4 hours prior to the study, and they were asked to refrain from food or drink for an hour before the study. Each participant engaged in 2 sessions. The session 1 was completed about 18 days before the second session. In session 1, the participants completed multiple questionnaires. So it was a self-reporting questionnaire. And they also, this is very important, they also did the parental bond assessment, and this will come back later. And the second session, again, completed about 18 days after the first one. The participants arrived into a computer lab in groups of 2 to 15. Each participant had access to their own computer. Each participant completed this exercise between 2 and 5:30 p.m. Participants, before they began the the video portion of this test, participants completed a set of questions that measure the positive and negative effects using a system called the Positive and Negative Effects Schedule, also known as PANAS, and we'll continue to refer to it as PANAS. All the participants underwent urine tests in order to double-check pregnancy status, as well as to detect drug use that would exclude them from this study. Prior to undergoing this study, a university nurse also checked their temperatures. All participants had to have temperatures under 100 degrees Fahrenheit. They checked their heart rates. All heart rates needed to be within 55 to 100 beats per minute. And also their blood pressure, which needed to be a systolic level of 90 to 130 and a diastolic level of 60 to 90. All participants passed except for one. One was unfortunately excluded as their vital signs were not within normal limits, and they were excluded from the study. Participants were randomly assigned a drug that was chosen through a website called random.org. The drugs were then prepared by a UCLA pharmacist about an hour before arriving. It was prepared about an hour beforehand. Participants received and self-administered the intranasal drugs. They did 1 spray per nostril every 30 seconds. The vasopressin was produced by the American Regent Laboratories. A pharmacist transferred that vasopressin was about 20 IUs per mil into sterilized, unmarked amber glass bottles with a nasal sprayer on the top. Participants did 5 puffs per nostril, and which gave them a total of about 20 IUs of vasopressin. The oxytocin was provided by Novartis Pharmaceuticals. The pharmacist transferred about 24 IUs per milliliter into amber-colored glass bottles. And the participants again administered 5 puffs from nostrils for a total of about 24 IUs. Now they did different IUs of oxytocin and vasopressin. Based on previous studies, they went with what they knew would probably give them the best clinical signs. For the placebo was 2 milliliters of glycerin and 3 milliliters of purified water with methylparaben and propylparaben that was mixed according to the formula to create a total of about 5 milliliters. That solution was then filtered through a 5 micrometer filter, and then that filter sample was poured into the same type of sterilized amber bottle that was unmarked with a nasal sprayer. Participants then self-administered 5 puffs of the placebo per nostril. After self-administering these drugs, participants were made to wait for 40 minutes prior to beginning the tests. During that 40-minute waiting period, the participants were asked to wait quietly. They had a stack of about 10 newspapers that they were asked to read from, and they were asked to please turn off their cell phones and resist speaking to one another in order to eliminate some of the human interaction prior to the tests. The participants were then given another PANAS test right before, so they were given that PANAS test pre-medication and post-medication. After doing that, they then completed tasks that are unrelated to empathy in a randomized order, and then participants were showed 2 videos. They were shown a negative video and a positive video. The negative video portrayed distressing images of the crisis in Darfur that included images of adults and children receiving medical care due to illness, starvation, wounds, just some fairly distressing images. Participants were then given a positive video to watch that was about surfers that were about people with autism. So it started off with a quick public service announcement about autism, and then they were shown an organization that teaches people with autism how to swim and how to surf. Immediately after watching the 2 videos, participants were asked to answer questions that were designed to assess their levels of empathy. The CARE subscale of the PBI asks participants to rate the affection levels by parents. So that first thing that I said earlier, how they asked whether parents were warm to them, they were given a 0 to 3. So 0 being very unlikely to do so, 3 being very likely. How likely is it that your father spoke to you warmly? How likely is it that your mother spoke to you warmly? Questions like that. And they created a mean composite of about maternal care was given at a 0.89, whereas paternal care was given a 0.88. 6 of the participants chose not to respond because they either did not have dads or they just chose not to respond to that question. So it did kind of skew those numbers a little bit. After the videos, the participants took part in a questionnaire where they rated their levels of empathetic concern about those videos. Given a 1 to 5, a mean composite scale was collected from that. And researchers noted that both the distressing videos and the empathetic concerns for the positive videos were at a 0.84 out of 1. To determine whether or not a positive or negative effect changed due to vasopressin or oxytocin, participants were given a 10-item PANAS questionnaire that they did pre and post medication. Pre-medication, before. So for the positive video, the pre-medication composite score was a 0.82. The post-medication composite score was a 0.83. For the negative video, the pre-composite score was about a 0.6, and the post-medication composite score was a 0.63. ANOVA, which is an analysis of variance, and then an ANCOVA, which is an analysis of covariance, was used to examine the interaction between drug conditions and maternal warmth, as well as drug conditions and paternal warmth. They used an omnibus interactions to investigate, through hierarchical linear regression, the analysis, to examine the difference between the two drug conditions at the time. Post hoc tests were then used of specific interaction effects were conducted using a program called Process, and then figures were created using Strata version 13. The results of this study were really fascinating. They found that the main effect of the video type, the distressing videos, elicited a larger empathetic response than the uplifting videos. For distressing videos, no main effect of drug, there's no main effect of the drug on the empathetic reaction, but there was a significant main affect from the paternal warmth versus maternal warmth. There was no effect. Maternal warmth had no effect on the participants' level of empathy, whereas paternal warmth had a significant impact on empathy. So for vasopressin, there was a significant interaction between vasopressin and paternal warmth and empathetic concern. Whereas participants with lower levels of paternal warmth did not have a significant increase in empathy, whereas participants who reported high levels of paternal warmth reported higher levels of empathy. Oxytocin did not have the same effect. Participants with higher levels of paternal warmth with oxytocin showed no increased levels of empathy, and participants with high levels of maternal warmth also reported no higher levels of empathy. And the placebo effect showed the same thing. Placebo effect showed that participants who said that they had higher, let me come here, right here. So if we look right here, this solid line is our baseline. If we look at this chart right here in these large dashes, this is going to represent vasopressin. So as you can see here, right here on our x-axis, we have paternal warmth, and on our y-axis, we have empathetic concern. As we get closer, as we go higher values on our x-axis, we'll notice that empathetic concern also goes up. So the more paternal warmth shown with vasopressin means higher empathetic concern. Whereas our oxytocin here does not, so this is oxytocin, this does not change. Empathetic concern does not go up, and it doesn't really go down. Whereas placebo kind of goes up, but not enough to make a big difference. In conclusion, paternal warmth had a more significant impact on levels of empathy than oxytocin or the placebo effect. Something I do want to note that the researcher said is that there was no difference in the gender of the participants on levels of empathy. Both men and women reported the same levels of empathy regardless. But the researchers did make a side note that there were significantly less men participating in the study than women. Women outnumbered outnumbered men in this study quite significantly, and so to get a really full picture, one would need to test more men. In conclusion, while this study sounds very promising, there are unfortunately still other conflicting studies. The role of vasopressin and oxytocin and parental care is not fully understood, nor is it fully fleshed out, which leaves great room for future researchers. Thank you.